Good to go. Good afternoon, everyone. We're going to call the Coronavirus Ad Hoc Committee meeting to order for today, December the 7th, 2022. Ms. Carrillo, if you will, please call the roll.
Livingston.
Here.
Barron.
Here.
Newton.
Here.
We have a quorum.
Thank you. Our next order of business is the approval of minutes from our last meeting. Do we have any changes that we need to add?
Approved, Madam Chair, for the minutes for June 29th, 22 and July 5th, 2022.
I'll second it.
I'll second.
Thank you, Ms. Newton. Ms. Carrillo?
Livingston. Barron.
Yes.
Newton.
Yes.
Motion approved.
Our next order of business here is we're going to, adoption agenda, I'm sorry. Do we have any? Well, thank you. But I want to make sure that we all have an updated version of the agenda. Do we have any changes or that we need to add to the agenda? And it's already been, there's a motion on the floor. We need a second. I think it's second. Ms. Carrillo, if you'll call the vote for the adoption of the agenda.
Barron.
Yes.
Livingston.
Yes.
Newton. Motion approved.
Ms. Newton, so you'll know, you're cutting off a little sooner before we can hear you. Our next item are items for discussion / action. Before we turn it over to administration, I just want to say that we have, over the past couple of months, we've had the application out for our ARPA for our ARPA funding. We've really done a lot of work to get to this point. And before we get to the ARPA funding, we're going to take up item A, which is seeking approval for 2 public service projects funded by the CDBG-CV funds. And we can find all that information on page 11. And at this time, I'll turn it over to administration to give us an update.
Thank you, Madam Chair. These are 2 very time-sensitive awards that need to be made. That's the reason that they're coming to you at this time, so that they can be taken to council on Tuesday night's agenda. So with that, if it pleases the chair, I'll turn that over to Director Sarah Harris to be able to explain this to us. Thank you.
Hi, good afternoon. Thank you so much for, good afternoon. Okay. Good afternoon, everyone. Thank you so much for having me here today. And I really appreciate you putting this together at the very last minute for us. It's very, very appreciated. We have 2 award-worthy organizations and nonprofits here in the local area that provide a lot of critical services for our underserved communities, particularly those who are under mental and health duress, as well as those who are in need of homeless crisis. So the reason why these tie back to COVID is certainly we know that COVID stemmed and sparked a lot of excuse me, I have asthma, so my breath is a little out of breath right now, but the reason why this is really important to tie back to COVID is we've seen so many different things impact our community, from the loss of jobs to the stress of COVID alone. And so as we see more people on the streets and addressing the housing crisis and all of these other applications, we're noticing that these underserved communities often become very neglected in this process. So it was really important for us to try to have these and get these grants to the finish line with these organizations because of the critical nature of the work that they do perform in the community. So it's with great pleasure that I bring these to you today, and I thank you so much for your consideration.
So if you would, for the record, give us a brief synopsis on the 2 vendors.
Yes, certainly. So what we have with Mercy is Mental Illness Recovery Center Incorporated. They're a fully accredited behavioral health clinic, and they provide our community members with great service for a myriad of different services, whether it is for disability insurance, to health insurance, to mental care and wellness. And so they have a very strong, robust infrastructure internally to help folks with this. In addition to this, they also have licensed clinical social workers, caseworkers that can help walk people through mental crisis or even health crisis, particularly for our aging populations. So the second place is Palmetto Place, and they provide a safe place for our youth here in the community. When I worked with Richland School District 2, Palmetto Place was my go-to place for all of my unhoused children that we just could not locate services for. They are a wonderful organization, and they have a STEP program that essentially helps people get on their feet. We have a lot of unhoused youth coming from abused and neglected homes, and so they help service a variety of needs with caseworkers, social workers, and they partner with our school districts to really help serve the community here in Richland County.
Thank you. So with that, I'll open up the floor for any questions or discussion from the committee. If you have any for, yes, sir, you're recognized, Mr. Livingston.
And we're talking about CDBG funds, correct? Not COVID funds.
These are CDBG COVID coronavirus funds. So they are essentially the COVID leg of the community development funds.
So these are not the regular community development fund. These are COVID community development.
Correct. Yes, sir.
And I want to acknowledge Ms. Newton in the building at this time. Welcome.
That's the only question I had. I just wanted to make sure it was related to COVID and just not regular CDBG funds.
Correct. Yes, sir. It is the COVID pot of those funds. Ms. Newton, you're recognized.
Thank you. Sorry, I was cutting out when I was in the garage. I had another conflict today. I just wanted to thank the staff for the work and for explaining that connection to COVID, because I know I had to call ACA Jensen this morning to make him connect the dots or ask him to connect the dots for me. So thank you very much.
Thank you.
Further discussion or questions? If not, we will need a motion in order to take this before full council.
I move to accept the staff recommendation about an item A.
Second?
Any further discussion? If not, Ms. Carrillo?
Livingston,
Yes.
Barron,
Yes.
Newton. Motion approved.
Thank you.
Thank you so much.
Next item on our agenda, as I was previously stating, was we're going to have administration to give us an update on where we are with our ARP funds. We put out $16 million for our community to be able to participate and be able to, I guess, bridge the gap for the deficits that they lost during COVID. And we had an overwhelming response. So now that the applications have been submitted, they've been vetted, now we're on to the next step, and we're going to turn it over to ACA Thomas to give us an update and next steps.
We did have an overwhelming response to our application period. You should have on your desk an informational agenda brief and two supplemental documents that were provided, and I do apologize for the tardiness of this. This has been a large task, but I will say that we chose well with our third-party vendor in giving us advice on how to manage this process. If you recall, we accepted applications from September the 1st until October the 14th, 2022. We had 427 applications that were received during that time frame for the $16 million. Which certainly was a great deal more than I think any of us were anticipating. And as we began to review these documents, we realized that there was a very wide range in requests and capacity for this, given that the total request was over $107 million. As we did this, the recommendation that came from Guidehouse, who is our third-party vendor, was that we really should perform a risk assessment on these organizations and the projects that are proposed. Best practice in the industry, in the standard, or in the industry in grants, is that an entity should not or should consider not funding organizations that have a risk score higher than 20%. So they should, you should be risk averse for 80% of the application prior to moving forward with consideration. Given the number of applications and the fact that we did have to begin somewhere to be able to determine how to prioritize these applications, we did accept that recommendation. And for the last 35, 40 days, that's what Guidehouse has been doing, is actually risk assessing that. If you'll look at the document that is green, white, and blue, this is the risk assessment that was done on all 418 applications. The difference between the 427 and the 418 being our priority groups that were funded during the budget. So they performed this assessment on all 418 applications. The scores ranged from 0, which is the highest risk, to 25, which is your lowest risk. Based upon that, the score for maintaining only 20% of the risk, or a 20% risk category for any application, should be 15 or above. From that point, if you will look at the last document, which is a spreadsheet entitled Summary of American Rescue Plan Act Grant Applications Risk Assessment based on U.S. Treasury requirements, you actually will have a layout of our total application population, the number of applications in each category of funding, the total requested funds, the average risk score in the actual category, the high risk score, the low risk score, and the number of applications that would have a score of 15 or above. Based on this data, of the 417 applications that were evaluated, 163 applications would now be able to be vetted according to our rubric to be considered for funding. That means that we had 40% of our applications that were actually appropriately risk assessed and would actually be recommended to be considered for scoring. With that, we would consider that if with committee's approval, that the next steps for this would be for Guidehouse to actually review these 163 applications and file it against our rubric, and then to come back with scoring based on those in the buckets and categories of funding. And with that, I will open the floor to any questions that you may have to me.
Thank you, ACA Thomas. Questions? Newton.
Guys. So let me first just check my understanding. So there is a rubric to assess risk, which is a best practice. And you evaluated all of our applications, which probably tacked on some time that you may not have been expecting to the evaluation process, but to be good stewards of taxpayer dollars, there was a risk assessment done on every application, and then you provided them here in every category. So here, what I'm looking at in the column that is a score that is lower than 15 would be considered the applications that are in the lowest risk category. And let me stop that sentence and just let you take it from there.
Actually, it's quite the opposite.
Okay.
It's those that are above
Those are
15.
above. It's been a long time since yes, this is, yes, bigger, yes. Okay, so then looking at this chart then, in that last column, the 163 applicants or applications that were outside of our risk threshold or in our risk threshold?
No, ma'am, that would be in our risk threshold.
Okay, that's what I thought. Okay.
Mhm.
So they are in our risk threshold. A column that I don't know that I see here, and so I just want to understand, obviously we had more requests for grant dollars than we have grant dollars available. Is that statement still true when you look at these 163 applicants that were within our risk threshold?
Generally, yes, ma'am.
Okay. And then what you're asking is, now that that part is taking a little bit longer, you're asking for approval specifically to use this as the threshold by which to now go back and review those applications that meet our criteria, the risk threshold criteria, so that you can make recommendations to us.
Yes, ma'am, that would be the accurate statement.
Thank everybody for their patience.
Lot to take in. Mr. Livingston.
For example, looking at the spreadsheet, let's say, for example, looking at affordable housing. What this spreadsheet is saying is that there are 5 agencies that would be further looked at for the funding for that particular group.
Yes, sir, that would be correct.
The risk assessment, did we do it? Did we keep it in categories, or did we just do all of them combined?
We did keep it within categories. That was another thing that somewhat slowed the process down, was that many of the applicants did not state their categories. So Guidehouse actually had to review every application to determine what category best fit the application.
I thought that would be important, so you won't, the money would be spread, sort of like council wanted if you kept it in categories, okay? I haven't had a chance yet, unfortunately, to look at criteria to use to assess the risk, but I'm questioning those. Thank you for that.
So what we have before us Full council has pretty much given this body as well as the staff the autonomy to move forward with the plan in place, but we want to make sure that we're covered as to the next steps that ACA Thomas has provided for us. And so as we look at noting that Guidehouse is going to look at these 163 applicants and file them against our rubric. And then from there, they will give us a final list of recommendation for funding. And so what this body also has to take into consideration is at that point, we are going to have to look at our applications and to say that because we have, the ask is greater than what we actually have. So this is not something that we need to determine today because we don't know who we're funding, but I just want to put this out here so you can chew on it for the next couple of weeks over the holidays. And that is to start to think about how we will look at awarding actual dollars. Just because they ask for it doesn't necessarily mean that we will give them full funding. For example, one of the costs that has been included in several of the applications per my conversation with ACA Thomas was vehicles. Well, that is not an allowable cost. So we already know that amount will have to be backed out. We'll also have to look at what is fair and what is just when we look to start to award funds, especially for our larger pots, like our small businesses and our nonprofits. There are a very large group of there are large groups there, and so we know that we have $1 million and an ask of 25 million. So as we move forward, it is something that we're going to, the next step is probably going to really require us to dig in and to spend a little time massaging the numbers. So at this point, ACA Thomas, would you like to have a motion from us for this? Is that something that is needed at this time?
Well, I'm not certain that it would be needed. It would be nice to just have on the record that we did do this. And just to let you know, I have had initial conversations with Guidehouse on this. We believe that by mid-January, they should be in a position to provide us the data that we would need so that when the committee is formed in January, there was a desire to have a meeting prior to council coming back in February, we could potentially have that as an option as well.
And that's good to know. And I'm glad you brought this up. So with that, before we take that motion, since you put this out here and we're looking at a timeline of having information back to us mid-January, perhaps there will be a meeting or not. We'll just say maybe not. And we meet in February. And when that committee convenes in February, do you have a recommended timeline for us to be able to make an announcement of the funds and to start to take our next steps as it relates to sub-recipients?
It would really depend on the number of applications that come back with a specific score within the rubric and how much deliberation the committee needs to take beyond that. If we were to find, as the numbers begin to come back, that we're looking at large numbers in certain categories, it could be that it might be prudent to ask councils or ask the committee for some recommendations, on priorities within certain groups. And I'm not certain what those are yet because I really have not been able to delve into these a lot. But that could be. So it could be as soon as once we have a committee meeting and then can get the documents together to be on an agenda, possibly the following council agenda. So you could be looking as early as February, potentially as late as the second meeting in March. But one thing I would also point out in this is that we are trying to be certain that as we move through this process, we maintain the integrity of this project. The reason that we're presenting just numbers and scores is that we believe that it's best for the third party to do all of this evaluation. Thus, there's nothing ambiguous about our process, and we are completely addressing this from an unbiased position.
Thank you, ACA Thomas, because I think that is very important as this body has really worked really hard to be non-biased and to remain neutral. And I think that Guidehouse has done an excellent job throughout this. So without any further discussion, I'll entertain a motion per the staff's recommendations.
I move to accept the staff's recommendation. But I do have discussion.
I
Sorry.
was getting ready to ask you. Okay. Discussion?
So just quickly, you talked about them bringing these recommendations back to the committee. And sometimes when you talked, I felt like it was this committee, and sometimes I wasn't sure if it was another committee. So just to be specific, to which committee are you referring?
To this committee, ma'am, COVID-19 ad hoc.
Okay, thank you. And then it feels like it's been a minute since we've had a committee meeting. And so as I've had a chance to look at the risk, I certainly appreciate them scoring it this way. I think that these are all reasonable criteria and could have potentially been even more stringent. So can you resend to me or perhaps the committee the rubric that they're going to be using to evaluate these? Because that'll help me as I'm thinking. And then just for the committee, this is a thought that I am pondering, because I think you asked me to noodle. I can't remember what you asked me to do over the holidays. But as we look at evaluating these things, one of the considerations that I would have is how well do these things align with some of the priority areas of our strategic plan? Because I have no doubt that all of the applications that meet this criteria are things that could be good. There's no shortage of that, but that's one thing that I'll be looking at. And I don't know if there's an opportunity that makes sense for us to have some of those priority conversations during the retreat, but I do think that it would be helpful. Thank you.
Thank you, Ms. Newt. I want to premature. So with that, I hear you when you say aligning the funding opportunities with our strategic priorities. I'm a little hesitant to say I fully support that, as that was something that was not a part of our application process. And as we start to think about grant applications and how these things work, traditionally, if we add something on the back end as a criteria of who gets funded, traditionally speaking, those priorities are listed in the application. And I may be mixing up here, but that's from a traditional standpoint, and I'm a little concerned about it. It's a great idea if we can do it, but again, I want us to be true to the process and the integrity of the process. And thus far, we've done a great job. ACA Thomas, can you speak to that to see it?
And can I just clarify a little bit more about what I meant? And your point is well taken. So my idea for noodling wasn't to add some new criteria on the back end about which people weren't aware, but to say, if you have 100 applications and you can only approve 80, and they all meet the criteria, all other things being equal, how will you make a decision? And in that case, the rubric cannot help you because the rubric has taken you as far as you go. So either you're using your gut feeling, or there has to be something at that point where you have identically scored things. I mean, you can flip a coin too, but that's where I was coming from, not saying that we add some new criteria and say, okay, you didn't meet it, but just, I still feel like we're going to end up with more requests than money.
I understand, and I think that you're absolutely correct when we look at it, and that will be something that we'll definitely take the guidance from Guidehouse on. But again, just putting my grant manager hat on, whereas these grants, they have a risk of, 15 or greater, there is still a hard score that they have. And so with that hard score, I'm thinking that's how we're going to probably delineate from who gets what, but that's
Right.
a
And
whole dig. We're going to really be digging deep into it. Any thoughts, Ms. Thomas?
Well, of course, this rubric will be a score for each individual application. And the hard decisions based upon scores that may be the same will have to be made by the committee based upon your discussions. But what I would point out in this whole process is that one of the key strategic items or key strategic goals that we had in our strategic plan was good governance. And I think this project has been an example of exceptionally good governance. So I think that we can certainly walk away from that. But then beyond that, beyond scoring and beyond risk assessment, the decisions will have to be policy decisions.
Thank you. Further discussion? Ms. Carrillo, if you call for the vote.
Livingston,
Yes.
Barron,
Yes.
Newton.
yes.
Motion approved.
ACA Thomas, is there anything further that you want to share with the body in providing us with this update, or anything that we need to, and it's not noodle, Ms. Newton, is chew.
Oh, I'm sorry. I'm chewing. All right. On noodles.
So that we need to chew on over the holidays along with all our other goodies.
At this point, I do not have anything, but if there's anything that needs to be communicated, certainly I'll reach out to the committee.
Thank you so much. If nothing further, our next item on the agenda is for adjournment.
Madam Chair?
Second.
Ms. Carrillo?
Livingston,
Yes.
Barron,
Yes.
Newton.